Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. I know, I could say this with every episode and every guest I speak with, but really, this episode continues to explode the myth of the minimal nature of symptomatic bridges and expands on the many ways, intentionally or not, they're getting brought to the surface, recognized, and accepted. Now, the process in which our bridges are being dealt with is another question that's being raised more and more often. I'm a proponent of the provocative test, as you all know. It gives everyone the best information possible. But there are times when that's just not feasible, as may have been the case with my guest today. She's an incredibly active woman, a former restaurant owner, actually multiple restaurants, and a children's store. Yes, quite the entrepreneur. And here's another kicker. She's a friend of a friend. And she started her journey at Stanford, but ended up getting treated in Sacramento. To unroof or not to unroof? It's an amazing story with a great outcome. Janie Desmond Ison shares her story that's going to bring surprise after surprise right from the beginning. Let's get into it. Janie Ison, welcome to Imperfect Heart.
Thank you, Jeff. It's great to see you again.
Boy, have we ever got a story for our listeners today. I want to be sure to share something because this is what really gets me fired up. It's one of the purposes of the entire program, and that is this 1%. In some cases, the doctors are saying 1% of 1% of us with myocardial bridges are symptomatic. 25% of the population has a bridge, maybe more. They're not quite sure, but let's say it's 25%, 1 in 4 people. Just here in the little circle of 10 to 15 mile radius of people, not third or fourth party referrals, friends. 2 weeks ago, we did an episode with a gentleman by the name of Mark Davis, a dear, dear friend of mine, coincidentally, a friend of yours,
Yes.
We come to find out.
Yes.
You, a dear, dear friend of another friend of mine who says, I know somebody that's got this thing called a myocardial bridge. We've got Sarah Miller in Folsom, which is just 10 minutes up the road, and Amanda Perlman, who's been on the program 15 minutes away. And somebody's going to try to convince me only 1%, even less 1% of 1%, but even 1% of this 25% of the population has a symptomatic bridge? No way.
No.
There is no way. That's too many people just in my little circle. And what, because I do a podcast that's related to it? It happens to be I connect with these people? That's not true. There's people suffering. There's people with undiagnosed, misdiagnosed myocardial bridges who are sharing with a loved one or a friend or a family member and going, oh, that hurts. Well, you got to go to the doctor. I did. Everything's fine. And in fact, everything's not fine.
Not fine.
So that's my rant for a minute. Just because it's so frustrating to me. I mean, there's so many more people. There are just so many more people that just aren't properly being diagnosed. And we're going to get to that with you, which is almost the opposite.
Yeah. Yeah.
Diagnosed and no motion, no movement on it.
Right.
So
But Jeff, your passion will get you where you want to go because you have such passion for it. And I've learned a lot from you too. And it's something that because you thought you were alone, that there was no one to talk to.
Yeah.
And so once I met you and heard about these other folks, it was nice to think, oh gosh, there's another atmosphere out there with people that have had what I've had.
And importantly so, because we're having the conversation, but there's others out there who aren't.
Right.
They are alone and they don't realize, and they think they're the only person with the condition. And while their symptoms may be different, similar but different, they tend to think, well, nobody else has that. Yet this condition is causing all of that.
Mm-hmm.
You know, shortness of breath is one of the symptoms.
Mm-hmm.
Heart attack-like symptoms, you know,
Mm-hmm.
pain in the neck or jaw, and you may not realize, no, that can be a heart issue,
Mm-hmm.
you know, a blood flow issue.
Yeah.
And people just don't realize. Gastroenterology is, I think, the proper way to say it. You know, people feel that in their chest. Sometimes that's heart as well.
Yeah.
You know,
Especially women. Yeah.
we just don't know. Yeah, we're going to touch that that
Yeah.
women factor in just a second. Tell us your story. What caused you to even get started on this path? Because it was relatively recent.
It was. I started having symptoms 15 years ago, 2010. And
And what
uh,
were those symptoms?
just, very subtle, out of breath. I was always really active. I've always exercised, ran, played golf, a lot of tennis. And so I was in good shape. And I think that's another commonality I've seen with some of the folks you've talked about. But I think that the subtleness of it is what makes it so easy to dismiss. I started to feel like when I exercised, I shouldn't be out of breath like I was because I was in good shape. That's sort of where it started. Then I started to get palpitations, subtle, not a big deal. Go to the doctor. Um, blood pressure's already low because I'm in pretty good shape. We'll watch you. And then it was they put me on, I think, metoprolol back then.
Mm-hmm.
And then it was fine. A few years later, 2015, I started to notice it was worse. And then I started to, the angina and just that feeling of pressure.
Like the
Went,
elephant on the chest we hear so often
yes, I
about. It's
know,
like, oh, I just feel
right.
something heavy.
Exactly. I'd be on a treadmill and I feel like something was just pushing me, stepping on me if I were to lay down. But no pain.
Mm-hmm.
Went to my nurse practitioner who started to take this a little more seriously. And they ended up giving me just a regular echo. Things looked fine. Fast forward, that was 2015. 2016, I think it was January, I just was like, no, something's really wrong. Okay, we'll give you a stress echo. I get the stress echo. My heart rate gets to 140.
Mm-hmm.
And I was like, there it is. Because they tell you when you feel the pressure, tell them, and they lay you down and they ultrasound you. And they could see it. It was ischemia. I didn't know this at the time because they don't tell you when you're laying there. And so, okay, you're all done. Good, because my husband and I are going to Carmel. We're going to go play golf for a few days. So we get in the car and we leave. And it was the next day, we were on the 14th hole at Poppy Hills, and I get a call from my nurse practitioner, and she says, "Where are you right now?" And I said, "I'm on the 14th hole at Poppy Hills having a great time," because we had restaurants and I was so busy. It was hard to get away, and I'd wait till after the holidays. So I was like, "I'm not going home. I don't care what you're going to say to me."
Mm-hmm.
And she said, "You need to get to either the nearest emergency room right now, put your golf clubs down, or come home immediately. We're admitting you into the hospital." And of course, your heart wasn't pounding before that. It is now.
Right.
And I said, "Why?" And she said, "Because you've got a blockage." And
And
I
what year is
said,
this now?
this is 2016. This is
Okay.
January
Okay.
2016. And so I said, "Okay, we're on our way. We're coming home. I don't want to go to the hospital here." We packed up and left, and I went right to the hospital. They were waiting for me out here at Mercy San Juan. And they said, "We're going to give you an angiogram, expect a stent."
Mm-hmm.
I don't even think I knew what a stent was, honestly, at that time. And so I got a stent. What was I? I was 45 years old. 55.
Uh-huh.
And there's no way I have a heart problem that bad. I eat well. I'm a vegetarian. I don't drink much. I don't smoke. I know I don't do any of the things that you would expect somebody with coronary artery disease to do
There's a
or
lot of
have.
heads shaking in the listening
Oh yeah,
audience right now going, uh-huh, uh-huh,
yeah,
uh-huh.
and yes. So okay, and my age. So I have the angiogram, and I'm in there, and you're kind of in a twilight. I remember it well because they were playing Journey.
Yeah.
I remember that, and then, okay, you're done. I said, no stent, no. And the doctors come in and they say, oh, you have a myocardial bridge. What's that? Never heard of it. Oh, it's where, the heart muscle grows over the artery and you're fine. We're going to put you on some medication
Benign condition, don't
and
worry.
you just go back to your life. So I'm thinking, okay, I go back to my life. I take medicine. I'm fine. And I remember researching it at the time. There wasn't a lot of information that I was getting, and of course that's changed a lot just because of the way we get information now. But even back then, there were some things, but it was always very vague. So I deduced that I wasn't dying. I'm taking medication. I'm going to be okay. But for me, because I already had a low blood pressure, being on the beta
Metoprolol.
blockers,
The addition of the beta blockers, yes.
yes. Yes, and it made me feel more tired. And whenever I do anything, like I'd play golf, especially if it was hot outside, I was just like, "Oh, this is awful. I don't want to live like this the rest of my life." So I didn't do well with those. But so okay, that's 2016. Things move along 6, 7 more years. Well, in 2022, it was getting a little bit more obvious something was really wrong. And by now, I'd had a couple of surgeries. Um,
Having nothing to do with your heart.
having nothing, yeah, more
Right.
all orthopedic stuff.
Yes.
So 2022 comes along, and I knew really I needed to see my cardiologist and get more testing. I did, and she said, I'm going to send you to Stanford. So I said, okay, because in Sacramento, nobody really deals with this. They have a doctor at Stanford and a whole unit of people at Stanford, and this is what they deal with. So we're going to send you there. And I'm, okay, great. And I did the initial consultation, and I think it was in January of 22, and was very impressed and went back and had a nuclear scan. They found that, they could see where my bridge was. They gave me measurements on it. And again, just said, well, your cholesterol's a little high. We'll increase your cholesterol medication. And because obviously, anyone that knows about a bridge, it's a point where cholesterol can accumulate above the bridge, and that could be a problem, even though you're not prone to any kind
High
of
cholesterol.
high cholesterol
Right.
problems. And I, okay, that made perfect sense to me. And I went along my merry way, taking the medication. So I saw them at Stanford twice, had a phone follow-up 6 months later to see how I was. By this time, I'd had a knee scope and a hip revision, and I was not doing well. And I was not bouncing back from this hip revision. And I just knew it was this bridge. I knew it was my heart. I knew something was really wrong. And my doctor, in the meantime, I've had all these Holter monitor things, the patches. And so they see the A flutter, and they see that my heart is really acting up more and more now.
Yeah, I saw you
They
had some
have the
ventricular
data.
tachycardia. So you were,
Tachycardia, PAVs or PVAs.
PVCs or
PVCs, yeah, well, yeah.
Yeah.
All the acronyms.
Yeah.
And atrial and ventricle.
Yes.
So I finally got to the next.
And for the benefit of those listening, the PACs, the preatrial contractions, not a big deal. They keep an eye on them. You don't want them to get too aggressive. But PVCs are significant because that's ventricle. And if the ventricle's not pumping properly, PVCs, if they go into multitudes, they turn into ventricular tachycardia, which can then possibly lead to ventricular flutter, which means the heart beats so fast, no blood flows, you pass out, maybe die.
Yeah.
So it is serious when you're presenting with multiple PVCs, especially if they're in and beyond triplets is what they kind of use as the
Yes,
gauge.
you're right. Yeah, I remember reading about that too.
Yes,
Yeah, so
yes.
I clearly in my case things had declined. That was when I was sent for a new echogram, and they found some more challenges with my tricuspid valve. The tricuspid valve was failing. It was not working right. The wall of my heart was thickening. My ejection fraction, which is the efficiency of your heart, the way I understand it, had dropped down to 45 to 50%, which I think normal is between 70 and 80. It's or 55 and 70, something like that. So that's not good.
Yeah,
good
they don't
trend.
want it that low.
That's not a good trend.
Right.
And fortunately, I had the data from before too, so they could see the precipitous change, the negative change. And so I was then referred to and a leak. I think it was the tricuspid valve that must have been leaking. So it was pretty immediate from there. They got me in touch with somebody to get an angiogram. I had that within a few days. And again, thought a stent. No
And I'm going to
idea.
back you up just a touch to Stanford. So you visit
Oh, yeah.
Stanford, you go through the testing, but you don't have what was called the provocative test. They don't go and actually literally test with the acetylcholine, the dobutamine challenge, the stuff that we're all familiar with today. And then, because you're a year after me, I was 2022 January surgery. Now you're late in the year, but yeah, still it's protocol to have this test. But for whatever reason, and it still baffles me. I'll conclude with some ideas later, but I'm befuddled because that's such a standard process for them.
Well, what I didn't understand about Stanford was I had an appointment, just a phone conversation appointment with my doctor about 3 weeks before this latest round of echograms. And she asked me how I was. And I told her, I am not doing well. I just had hip surgery. I'm struggling. She increased my medication. And we'll see you in 6 months. If I'd waited that long, I'd be dead
Yeah.
because my heart was failing. But I don't understand. There was something in the report I just recently read that was contradictory. So I don't know why it wasn't. I didn't feel they took it seriously enough for my symptoms. Again, you mentioned it earlier on in this conversation that I never had pain. I never had pain, and I was strong. I knew I was getting weaker, but if you don't know me, you're a doctor. I see you twice a year. Um, but I think that they just sort of felt like it wasn't bad enough to really act on. And in the meantime, I had all these other things happening. And it was a severe stenosis in my nuclear scan report. It said severe stenosis. What did they call it? The focal, um,
The
you
lumen,
said it earlier.
lumen. Yeah,
Yeah,
the lumen was
yeah,
occluded, clearly
right,
occluded.
completely. Yeah. So I don't know how they could have missed that. Fortunately, once I had the angiogram, my surgeon realized that this was a really bad situation. He saw the angiogram results. That was on a Thursday night. He had me come in the next morning at 8 a.m. and for an hour explain to me what's wrong with my heart. And I sat there listening to it thinking, I need a heart transplant. I mean, it was every chamber. There was something. And in my head, it all started with the bridge because it was a chain reaction. If you kind of step back and look at it, just the fact that that blood flow was restricted for so long with somebody who did a lot. I wasn't sedentary, and it backed up. It was clogged, or it wasn't working, and so the rest of my heart wasn't working. It doesn't seem that complicated, and yet it seemed to have been to doctors that may have missed the big picture. And he picked up on the big picture and explained how everything was connected, thickening the wall, the tricuspid valve and all of that. So you need surgery. I could not believe it. I was in a state of shock, probably. I was on my way to a wedding for a dear friend, and I had my suitcase in the car with my husband, and oh, I'm having open heart surgery. I've got to get back for that. You don't think about that at that
Mm-mm.
age. So,
So you've had a golf game disrupted,
oh
and
yes,
you've had now
absolutely, and a
almost a
wedding. Yeah.
wedding disrupted
Oh yeah.
because of this
Yeah.
condition, years apart.
That's right. Yeah, I have a social life to attend to. I
Yeah,
don't like
right?
any of
Just
this.
don't plan anything big in the next few years. You'll be fine.
So anyway, I came home and had the surgery. We can talk about that.
Yeah, let's touch on that. The surgery is not the surgery that most of the people
Mm-mm.
listening are thinking. They're going, "Oh, okay, so you got Unroof." No, you didn't get Unroof. The choice was to do something different because the significance of the blockage was so great that it wasn't the bridge that was the concern, it was the blockage that was the concern. So go ahead and
And I had asked the Stanford doctor about the bridging, the unroofing surgery when I first saw her, and then when we followed up again after the nuclear scan. And she said, your bridge isn't that bad, and we could do the surgery, but if you want to. And I'm like, do I want to? No, of course I don't want to. Should I is what I need to know. I need
Mhm.
somebody to tell me. I'm a lowly restaurant owner. I don't know anything about heart surgery. So I wish back then I had just had a better conversation on whether or not it made sense to do the roofing because of what could happen down the road. I never had that conversation.
Mhm.
And this was not a long period of time. This was
No.
like 16 months. So a lot happened in 16 months. And so I'm sure we'll talk about advice we have for other people.
Oh yeah, we'll get there.
But that's one regret that I do have. But yes, so I ended up having a surgery that had nothing to do with unroofing. They bypassed the artery
Mhm.
and another artery. And I should be able to tell you which one. But I don't
Well, we
know.
know the LAD, the
Yeah,
left
oh yeah,
anterior
the
descending. That was the
LAD. That was
primary,
the
and
big
that's
daddy.
you were 90% plus?
95 plus, yeah.
Okay.
Yeah. No,
That's
that's
no
not
questions asked right now.
that is no questions asked.
Get done.
And even me, when I saw the photos from the angiogram, I go, "Oh, this isn't good."
Right.
And I know nothing about the heart, like I said, but and then even traveling, we flew down there and I was worried. I was very scared once I
Mhm.
saw that picture. I was like, "Oh, it's bad."
Mhm.
So, yeah, so do you want me to tell you about the surgery, what they did,
I do.
or?
Yeah, let's talk about that because I know everybody's going, "Well, wait, you didn't get unroofed, but you seem to be fine. Why are you on the show if you're not unroofed?" Well, because you have a bridge and there's a process that they went through that is occurring with some of us with bridges as well. And what we don't know from the material we've got is if that occlusion, if that 95+% was right at the point where the artery enters the heart,
Is
because
It
100%,
was.
oh, it was, you
Yeah,
know that.
yeah, yeah. You can see it on the picture. It's where the
Oh,
bridge is. It's where
okay.
it
So, well,
starts.
there we go. There's the
Yeah,
answer. So it is the
yeah.
bridge that caused the
Oh,
blockage.
yeah, yeah. It
And
had to have been because, like I said, all my other arteries were
yeah,
clear
so
and
rather than go through and unroof the artery, he just did the bypass at that point and probably did do, we'll call it a slight unroofing, just where they typically, this is not uncommon, where many surgeons who are performing bypasses say, "Oh, we see this all the time." Back to our conversation about the 1%
Mhm.
being symptomatic, they see this blockage all the time where they're doing a bypass and they just cut that little muscle tissue over the artery so they can graft it appropriately. Well, people, if they didn't have a myocardial bridge, they wouldn't have the
Yeah,
blockage. So, okay, so good to
yeah,
know.
yeah.
Good to
And,
know.
and I asked him later, I said, why did we have to bypass it instead of just cutting it free? And he said, just because, that's the way I like to do it. I think it's secure. Your case, this is what I did.
Mhm.
And I appreciated that. And there were other things involved. So
And so they did go in and they corrected some of the valve dysfunction,
yes, he
everything. They
he
did all of it.
repaired my tricuspid valve. I have some kind of a ring in there. He did an atrial clip.
Mm-hmm.
He did a Maze 3 procedure.
Mm-hmm.
And yeah, the tricuspid valve and the two-way bypass. That was enough.
And so the two-way is because he saw something,
Yes,
which
yeah,
I would bet, even though they didn't identify, at least through the stuff that you're aware of, the documentation that you're aware of, that second artery probably was either slightly bridged or entered and came out quickly. And he just said, you know what, we're going to bypass this too, just to be safe. We don't want to
Would
have
be.
that risk of having to go back in again.
Yeah.
And
Yeah.
that wouldn't be uncommon. And I will say again, to the credit of the surgeon for identifying it, he's in there with a sternotomy.
Yeah.
So it's
Yeah.
not thoracotomy. They're not trying to do
No.
something minimally invasive that may not have picked that up
Yeah.
in your case.
Yeah. Yeah.
And since you did need other work in terms of the valves and
there was
everything,
no way I could have done
they
it
weren't
that
going to do
way.
it minimally
Mhm.
invasively.
Yeah, and I think it has something to also do, even with the bridging, unroofing, where the bridge is, right? It's the location of it, whether they can do it thoracically or, you know.
Depends on who you speak with.
Oh, really? Oh, okay.
Yes.
Well, that's a whole nother
Yeah,
conversation.
it is a whole other conversation. We have spoken to the world leading cardiothoracic surgeons doing it robotically, and most will say they could probably do any of it robotically.
Uh-huh.
It's a choice you get to make.
Yeah.
You know, if you're in there and you do it with the best information you can get
Yeah.
from both them and traditional,
Yeah.
and then choose.
Yeah.
So I don't give an opinion on it because it's an individual choice
Mhm.
based on the information you have at the time to make
Yeah.
that decision.
Yeah.
So you have the 2 bypasses,
Mm-hmm.
you get your valves fixed,
Mm-hmm.
everything's done, you're going back, you're healing now from your sternotomy,
Mm-hmm.
and this is in 2020.
This was
3?
November. Well, that was October of 2023. I went home after 9 days. I was home for about 3 days. I had terrible AFib in the hospital. I really wanted to go home, and worked through that. And then I started having some other issues, and my home nurse could hear fluid on my heart.
Mm-hmm.
So I went back to the hospital and ended up, sure enough, I had pericardial effusion,
Mm-hmm.
and I needed another surgery. Went in on a Friday, had it Saturday morning, a pericardial window, they call it,
Mm-hmm.
to drain that fluid. And then I stayed in for another few days. That was not easy. That was really difficult.
And didn't you have some pleural effusion too as well on the lungs? Water?
No, it was just pericardial.
It was just
I
the
think.
heart.
Yeah.
Okay.
I think.
Okay.
That was, yeah. Just don't tell me anymore. That's all I need to know. I need surgery. I don't want to know anymore. But
Right.
yeah,
Now, and that one they
it
were
was
able.
a tough time to comprehend everything that was going on. You're still medicated. You're in pain, and you just look at everyone like, tell me what to do. I can't make any decisions.
Mhm.
That's how I felt by the time I went back in there.
And at that point, they were able to do minimally invasive to drain
Yes.
the heart.
Yes.
Okay, so they did a thoracotomy, went through
Yeah,
the side.
and then they had a drain in my neck when I came out, which some kind of a weird wire. I didn't like that. But yeah.
Yeah,
Yeah.
none of us like all that stuff coming out of
Oh,
our
yeah.
necks.
We don't need to talk about all the tubes, and I mean, but yeah, it's something that I kind of wish I had known beforehand. There's a lot they don't tell you.
Yes.
There's just a lot.
I will say, I go through a basic step-by-step process of that everything I recall in the book. You know,
Oh, you
it's-
do?
it's-
Which I haven't had the pleasure of reading yet, but
it's the remember the things you need to remember. Like, don't eat before you're going in for an anesthetic procedure. Otherwise, they're going to do it locally, and it's very different
yeah.
because I didn't pay attention.
Oh,
you know?
really?
So I had one of those situations.
Oh,
It
no.
was brutal. But the thing we're referencing, because I know we had a bit of a laugh
Yeah.
about it, and everybody I speak with does as well. So if you have a full sternotomy, more often than not, you end up with these 2 tubes in your chest.
They're garden hoses, Jeff.
Yes.
Is what they are. Let's call it what it is.
Yes.
They're not tubes.
Yeah, they are large, and they're to drain the chest cavity from the surgery to
Yes.
keep it from buildup of fluid. They don't tell you what it's like to get those things removed.
Mm-mm.
And it's amazing. It really is amazing. And it's not fun, and it hurts. So,
Well, or they hand you the spirometer to blow into to get your lung capacity built up again.
Uh-huh.
And with the tubes in with your lungs, I still, for months after that, when I had to take a deep breath, thought, okay, brace yourself. It's going
gonna
to
hurt. Yes.
But you get through those things.
yes, because the tubes are hitting the bottom
The
of the
tubes are
lung. and
important.
It's no fun, and they're important. They have to happen. And so is that spirometer.
Yeah, the
It's-
spirometer is very important.
very
but
important.
If they tell you about those tubes before you go in, and anyone listening, I hope this doesn't dissuade you, but It'd be like, you're going to go to a 5-star hotel, and by the way, we have ants, but we can't tell you. And, are you going to go or not? I don't know. Are you
Right.
going to have heart surgery because you have to have tube issues? I don't know, but
The
you got
good
to have
news
the
is
heart surgery.
it's over in
It's over.
30
Yes,
seconds
yes.
once they
It's
pull
just
on.
one of those things. I like to be prepared for things,
Yes.
and I wasn't prepared for that. I
Yeah.
would have rather have known.
Yeah, I think none of us really were. You cannot
Yeah.
fathom that particular, even though we're talking about it, people have probably seen it. You can go online and find it, I'm sure. You just don't know until you do it.
Yeah.
It's just one of those things.
The first thing my surgeon did say when we signed on the bottom line, he goes, now stay off the internet until the surgery.
Smart.
Oh, very smart.
Yes.
Because that's the first thing I did later.
Yeah.
I'm glad I didn't do that before.
Why scare the heck out of yourself,
Yeah.
right? So 2 bypasses, no unroofing surgery, true unroofing. I'm going to guess that since that is where you were occluded, that there was a little bit of a cut made on that heart tissue,
Mhm.
that myocardial tissue of the heart, just to give them access beyond
Yeah.
the blockage. And we know that happens with typical bypasses. So today, so 2 years, a little over 2 years.
No, it's a little
not,
under.
Well,
It's
not quite 2 years. That's
18
right.
months, 6, 8, yeah.
How are you?
I'm good. I do have a cautionary tale. I struggled a lot still with tachycardia issues and just irregularities. And
Through the process or today?
today,
Okay.
in the last few months,
Mm-hmm.
6 months. And I started panicking. I went to my cardiologist. She put another monitor on. They could see the pattern. Oh, yeah, you're loaded with these things. So I'm like, oh, great. Now what? Well, it turned out and she sent me to an electrophysiologist. And he said, okay, we can do another ablation. We can increase your medication, which they did. They quadrupled my metoprolol, which is hard on me because I already have low blood pressure.
Mm-hmm.
And these were not going away. And it was very scary. It was almost 90% of my day, including in the evening and night. Well, I happened to go into my primary care doctor for something completely different. And I mentioned this to her. And she said, oh, you take hydroxychloroquine for rheumatoid arthritis, which I'd only started 6 months ago. She goes, that can cause these kinds of heart symptoms. I said, you're kidding. So she called my cardiologist. Should we take her off? Can we try this? I had no symptoms within 3 weeks. None, zero of
As
going
soon
off
as you
that
stop.
medication. So another, and I haven't had a lot of experience with a lot of different medications until these last couple of years. But again, you read the leaflet that says
the
all of
warning
your, and we
labels.
just dismiss that. But yeah, so if you always look at your medications, if you know something's not right. I found out I had the bridge because I pushed. I knew something wasn't right. I just couldn't put my finger on it. If you know something's not right, you just have to keep pushing until you get the answers. And if you don't have a doctor that will listen to you, get another doctor.
Mm-hmm.
Again, especially if you're a woman, we have different types of symptoms. We didn't really go too much into that, or I didn't earlier. But because I never had pain, I went to the emergency room probably 3 times over heart things. EKGs were normal. They'd say, what's your pain level? And I'd say, well, I don't have pain. Well, right there,
Oh, you're okay.
Yeah, exactly. And your EKG looks fine. You don't have pain. Go see your doctor.
Mm-hmm.
Well, I've seen my doctor. I still, but those are the things that you cannot just take at face value. You have to dig deeper and push harder.
Mm-hmm. And what you're saying is what we hear so often, the dismissal.
Yeah.
Unless you present with something like a true heart attack, that's the last thing they start thinking about.
Yeah.
And what we're really advocating, and you individually, everybody listening to this episode and any of the episodes, is you have to self-advocate. You have to do this for yourself because nobody knows you better than you.
Mm-hmm.
And if you know something's wrong, 99% of the time, you're right.
Yeah.
Something is wrong, and you just have to keep pushing to find out at least an answer. Maybe not the solution, but at least get to the point where somebody recognizes we are in agreement, something's wrong.
Right. Right. And at
we'll take
least
it from there.
validate what you've been going through, and then you take the next step however you can take it.
Mm-hmm.
But the stats that you are quoting, and I have 8 brothers and sisters, and I think, gosh, and my dad had a 5-way bypass and passed away 7 years later, just like dropped dead. But I just wonder who else out there has this, and in the work that you're doing to get people to understand what it is. Um, it has to be done because for the reason that doctors are just so easy to dismiss.
Mm-hmm.
And you don't have chest pain. You have these sort of, they're not consistent symptoms. But talking about it helps. It helps the next person. And, we can talk also about what it's like after surgery, as far as from emotional standpoint. I found
You're
I
answering
really
the very next
struggled.
question. That's exactly what I wanted to
Yeah.
ask you. Where's your head going through all this? What was happening with you and family members as you're explaining? Tell us about it.
Well, my husband was amazing, and great support, and took such good care of me, and was wonderful. I will say, my grandson was the one. I really in the hospital didn't think I was going to make it after about 8 days. I just didn't. I didn't have the energy anymore. I was exhausted. The AFib was horrible. And I remember him sitting on my bed. He was 14 at the time, and saying, "When are you coming home?" And I said, "Because you're coming home, aren't you?" And it was that, there's always that one moment that sort of clicks in your head, like, I can do this. So that was my moment. After the surgery, after the healing, the cardiac rehab is amazing. Do it. Even if you think you're fine, do it. The camaraderie in there was great. The staff was great. I was with Dignity Mercy downtown. And those things help you emotionally, mentally. This kicks your butt, the surgery, on every level. I was grateful to be alive. I looked at everything. I looked at my family different. I looked at my friends, my life, my priorities. And I hear that a lot. I've talked to the people that I talk to that have had cardiac surgery in general. So I would say, getting back to the things they don't tell you, that's one of them. Sleep. Sleep was hard for me. It was hard for a lot of the people that I talked to. Was it for you too?
Absolutely.
Yeah, they don't tell you that.
But for a different, I don't know, for the same reason. What was your sleep issue?
I don't know. I just had a lot of trouble sleeping. I still do, actually.
I don't sleep a lot, never did. I try now to force myself to sleep longer,
Yeah.
but it's not comfortable for me. But
Interesting.
the discomfort was one thing. It was hard getting comfortable and trying to go to sleep. But I remember vividly my wife saying, "Why are you still up?" It had been 2 a.m. I was afraid to go to sleep
Oh,
because I don't know when I'm going to wake up.
yeah.
I said,
Oh, yeah.
I just need to be so exhausted I fall asleep.
Yeah.
Because if I consciously think about it, I don't know. I don't know.
That's interesting. Yeah, I can see that.
The fear of, I'm home. What if something happens if I go to sleep?
Oh, that's a very real thing.
right.
That's a very real thing.
Yeah.
Yeah. So you're not sleeping now? You're just not a big sleeper?
I'm not a big sleeper.
Yeah. Okay, well,
I
I've
mean,
always been a really
6.5
big
hours
sleeper.
for me is a good night.
Oh, okay.
7 is like, wow, that's a long.
Yeah,
I
yeah,
slept
yeah.
a lot.
But I think for me, it was probably a lot of, again, analyzing my life for a long time. I went through that. Should I sell my business? I had a very demanding job. I had a restaurant in Old Sacramento, and it was very busy,
Mhm.
and I was very hands-on. We also had another restaurant, Cafe Vinoteca, which we sold right before COVID. So I've lived a very busy, and I had baby store Puddles, 3 businesses at one time, and so I didn't have time for any cardiac problems or anything for that matter. So you go through that. Now you have a heart problem. Now you have surgery. Now you have to take care of yourself. That is hard. And you have to adjust to that. But having people to talk to is really important that have been through it. And I just can't stress enough, if anybody listening has to have this surgery or the unroofing surgery, think about that. Get those ducks in a row before you come home, and make sure that people around you understand there's a big psychological component to any heart
Mhm.
surgery or any heart condition, probably.
Well, because the expectation, okay, you're back, but you're not.
Oh, no, you're not.
You're not. First of all, we have that sternal precaution, number one.
Yeah,
Second of all, we
God.
have the whole head
Yeah.
case
Yeah.
situation to deal
Yeah.
with and adjust and the reality of our mortality.
Uh-huh.
And then the third one is just the physical capabilities of having had heart surgery. You
It
can't
does
do
change.
things.
Mm-hmm.
You certainly can't. And you have to be very cognizant of what you do
Yeah.
in those situations.
And the heart, well, it turns out it's kind of important. And so we have to look at it differently than like, knee surgery or hip
Mhm.
surgery for that matter. So it's a very serious subject. But in so much as it's serious, it's easy to just, I don't want to deal with that right now.
Right.
Think about something else.
And
You
that's,
can't.
again, back to that 1%. Too many people are living in denial.
Yeah.
And for spouses who hear their spouse or significant others who hear their significant others say, I'm not going to go to the doctor. I've got this, I'm a little winded more than normal. If it continues, you have to go get that checked.
Yeah.
In more cases than not, you're fine. But why find out that you are one of the 25% that maybe you waited too long and now it's complicated and has other complications and everything gets a little more difficult as we get older. We know this condition only gets worse. It never
It does
gets
get
better.
worse. Yeah.
It can't heal.
Yeah.
It's created enough problems already. Coronary artery blockage doesn't dismiss and go away.
Yeah.
It just continues to get worse.
Yeah.
The heart conditions that it causes, whether it's endothelial dysfunction, vasospasms,
Mm-hmm.
or microvascular dysfunction, all of this continues to get worse. It cascades. And I think as you get older, it makes it even that much more difficult. So if you can get this done at X age, why wait another 20 years to get it done when it's just that much more difficult? Not to mention you have a risk in between
You have a big risk in between.
because we don't know.
And it's hard on our spouses
Yes.
and our families. And why make them go through this if they know something's wrong with you and you're not ready to confront it? It's very hard on them.
Mhm.
And seeing now what they go through, like, yeah, they deserve credit, a lot of credit, because it's not easy to see somebody through this.
No, totally agree. And it's hard watching being the patient, seeing everybody try to accommodate, understand, learn, support. What can
Especially
I do
if you
for
don't
you?
like that attention.
It's,
Just leave me alone, I'll be fine. And come back, just give me some food and I'll be fine.
I had a whole
but
issue in the hospital with a nurse who, Mr. Holden, everything's fine. I am going to be you. You don't have anything to worry about. I'm going to take care of everything. And I'm like, no, that's not me. I will take care of everything until I need you. I will call
Yeah.
you. Unfortunately, he didn't get it. And he kept trying. And I finally said, get him out of here. I don't want him.
Oh, really?
You have to make him go away because if I could, I would punch him.
Oh, yeah.
How are we doing today? I
Yeah,
think I
no,
had
it's-
the surgery. We didn't have the
No.
surgery. My
You're-
chest is cut open here,
Yeah.
not yours.
Yeah.
We are not we, I'm me, and I'm doing just fine. I don't need you asking. There's a point where you
That's
just get,
funny.
it's frustrating. You just get, and they were wonderful for the most part. It's just,
Yeah.
you
Well, I
know,
think cardiology professionals are really some of the top of the top.
totally agreed.
Yeah.
Totally agreed. So what are you doing today?
I just sold my restaurant.
Congratulations.
And thank you. That was just a couple months ago. I just had spine surgery, but I'm doing great. So I'm looking forward to getting stronger again, going back to playing golf, traveling, and not worrying about my heart anymore. It's nice. It's really nice. So I can exercise. I've been walking more. I have no issues at all. And that wasn't the case, last time I was able to walk 3 miles.
Yeah, that's
So,
what
yeah,
everybody
no,
wants to hear.
it's-
No issues at all.
It was a rough road and a tough journey and a long journey, but I am great now
Mhm.
and I'm grateful.
That is fantastic to hear. And again, for the benefit of those listening, you didn't have an unroofing surgery, have a bridge, but in many cases, the unroofing surgery is done in conjunction with a bypass. And there's dialogue that I'm aware of about the benefit of the bypass. Do you necessarily need to have the unroofing surgery if that is your primary issue?
Hmm.
Depending on your age. They don't want to do it to somebody too young where they're going to have to do that bypass again. It won't last.
Yeah.
But
Or if you have other arteries that are really
yes.
compromised.
Yes. So we're going to be hearing more and more about this. It started out with just the bridge and getting the awareness of the bridge out. And then it was the bridge and the vasospasms and the endothelial dysfunction. And then it was the microvascular dysfunction, MVD, microvascular disease, which is where we really are today in a lot of the conversations of symptomatic patients who have been unroofed. And now we're taking it even another step further about, well, wait a minute, if that artery is bypassed and the original artery has an issue, is it an issue if it's not the primary feeder to the heart?
Mm-hmm. Mm-hmm.
So
Yeah, there's
these questions are,
yeah.
it's all so new.
Yeah.
And we all have to be patient with it because it can only move so fast.
Yeah.
You know, I'm 3 years. So this really started me before 5 years ago in earnest, where they were really getting into, okay, we can fix these things. We can do this surgery. The surgery is improving the quality of life for the majority of the people.
Yeah.
And we know we're on the right track. Well, we're still on the right track. It's just that we're learning more and more and more as we go.
Yeah, it seemed pretty black and white when I was first looking at what a myocardial bridge is.
Mm-hmm.
And again, the dismissiveness of that, sort of pat you on your head, send you on your way with medication, you're going to be fine. Knowing now if I wish I'd known then what I know now, because it's not that black and white at all. And
Mm-hmm.
like you said, everybody's a little different. I had symptoms for years. Your situation, if I remember correctly, was not that way.
No,
You
it
were
was
very,
0 to
very,
100 in
yeah, and same with
6
some of
weeks.
your other guests. So
Yep.
there is a huge range of how you present with this condition.
Yep.
And so people just have to, if you listen to this and you're feeling fine, you might know somebody else who isn't. And that's important. You may have
Mm-hmm.
a sister or a brother or a parent. And a slight little, I just am not right. I just feel a little tired when I exercise. Don't dismiss it.
Right. Yep. So, so true. Well, Janie, I'm so pleased we were introduced by our mutual good friend.
Yes. They are wonderful people too,
They
by the way.
absolutely are. Your story, your situation, your process, recovery outcome is so different than the majority of people I speak with, only because it was a different
Mm-hmm.
case. They're all different, but there's those similarities. And to have somebody with a bridge who has been repaired not through unroofing, I think is important to get out there because other people can start to ask that question. It's just
Sure.
one more in the litany of questions you can now ask your cardiologist and or your cardiothoracic surgeon as you're going through the process. And you're going to get answers. And they might even say, hey, you know what? Maybe in your case, we don't need to do the unroofing procedure.
Yeah.
Maybe it's just the bypass.
Yeah.
And less is always more in the case of surgery. So that's a true benefit for everybody as we're having this conversation.
Well, I hope that anything I've said or that you do, I know will help people, but that's my goal now. And we were talking about earlier the other day, just getting the awareness out there is what our job is now because we've survived it. We've gone through it.
Mm-hmm. So the one thing that we did talk a little bit about it a little bit earlier in the conversation, but again, just for the benefit of everybody, it's really, you have got to self-advocate. I just can't say it enough. I've even got to repeat it in my notes here. Self-advocacy, self-advocacy, self-advocacy.
Yeah.
And we know when something's wrong. You have to keep pushing. If it's the wrong doctor, get another doctor.
Yeah.
You know, if you're not getting solutions that are acceptable in improving the symptoms, keep moving on.
Yeah.
You will get there if you continue.
And I think, honestly, the reason for that, it's not like, if you have a box of C's candy and you say, I really shouldn't eat another piece of C's candy. You're questioning yourself, should I or shouldn't I? Okay, that's different than something might be wrong with my heart. Should I talk to somebody or shouldn't I? And the reason I think people don't is fear. That's the only thing that makes sense. C's candy, it's fat. With hearts, it's fear.
Well, hearts, it's death.
And that fear of what they're
death.
going to say, which is,
Yes.
you said it earlier, our immortal selves. What does that look like? We don't think about that, especially the younger we are.
Right.
Which, I don't know about you, but I think about that a lot more now, only because I felt like I came close to that call.
Mm-hmm.
And it changes you that way too. But when you're younger and you're active and you feel like nothing could interfere with that right now, I can see why people don't want to push.
Mm-hmm.
But I say push.
Totally agreed.
Yeah.
We're both preaching to the
Yeah.
choir on
Yeah.
this one.
Yeah.
And that's exactly what I wanted to hear because we can't stress it enough. And if you hear of somebody, a friend, a relative, significant other, whatever it is, they might share it with you because along with that fear, when you're in fear, you deny.
Yeah.
It's denial. I remember in my case, I rode that bicycle 6 different times in training with the pain going, well, it goes away, so it's fine.
Yeah, that was quite a story, Jeff.
It went away. It's fine.
Yeah.
It can't be my heart. It can't be my heart.
Yeah.
Until you
It
know
is.
it is your heart. And that's not something to be messing around with.
Yeah.
Well, I thank you so much for sharing your story
thank
with us.
you.
I'm thinking I'm going to have a barbecue. Literally, there's 5 of us within such a
Absolutely.
close area. We're recording
Sign
this
me up.
in June. And that's a party at 10
Yeah.
with all of us talking about our situations in some way, shape, or form.
And then our significant others can sit in the corner and go, oh my God, I'm glad that's over.
Not again, right? Not again. I have to hear the story one more time.
Yeah.
So we've got Sarah Miller, Amanda Perlman, yourself, Mark Davis, and me.
Yeah.
And if we do this, we will do an episode, from the backyard for the benefit of all of those. Just say, hey, you do recover.
Yeah.
And things can get better.
Yeah.
And while they may not be 100% for everybody, they're certainly improved for the majority of people that have some semblance of repair.
Yeah.
And in your case, lucky for you, it was done through the bypass surgery.
Yeah.
Well, from the bottom of my imperfect heart, Janie, thank you so much.
It's my pleasure. Thank you for having me.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.